We've been trying to organize for one reason and one reason only, and that's patient safety. That's our number one concern, and we have risked reprisal and retaliation to speak up for our patients for any sort of solution that would give them standards of care. We've lost 33 nurses in 3 years at our hospital. 2 retired early and 31 have just outright quit. We stand to lose 6 more if things don't change. And if you ask me why, it's because of unsafe staffing. I wish everyone could see how frequently the nursing staff is pulled into situations that are unsafe. It happens on a daily basis. Every day we are concerned about the safety of the patients we care for and the means of our livelihood. As licensed professionals under the Minnesota Nurse Practice Act and the Nurses Code of Ethics, we are held accountable for maintaining the safety of our patients. If we make a mistake or if we accept a patient assignment beyond our abilities, we are at risk of discipline through the Board of Nursing and or our employer, or even with the possibility of malpractice case in a court of law. In addition, we have to live with the moral distress that we may have overextended ourselves past the point where we can safely care for our patients. Understaffing occurs on all of our shifts. For example, during the night shifts, which I work on a regular basis, as one of only 3 fully trained nurses in different units, I'm asked to be backup in the OR as well. On the weekends, we have no backup nurse for me when I'm called away from the floor to work in the OR. When I'm in the OR, I'm the on-call nurse and the working charge nurse at the same time. One example is recently I worked my 7 p.m. to 7 a.m. shift. I had to stay for an emergency surgery. I was there till 1:30 p.m. I went home and slept 3 hours, and Kate got called back for another emergency surgery at 5 o'clock. And I was there till 1 in the morning, and I was expected to stay in with my shift till 7 a.m. I asked the charge nurse that also had to work 18 and a half hours because I was in the OR to call the assistant DON in to work for me because I could no longer physically or mentally care for my patients safely. After informing, although she is not trained to be in the operating room, if a necessary surgery would have been needed after that, the patient could have been at risk due to the inexperience of the nurse who was forced to work in a situation where she was out of her element due to the chronic understaffing issues. Shifts like this are all too common. They're the norm, not the extreme. This is when mistakes happen. This is when the patients don't get the medication at the appropriate time, or they get the wrong medication because there are not enough nurses to monitor the timing of the medication. We have had patients left in the ER for as long as 8 hours waiting for a bed because we don't have the staff to admit them. This only delays the care of those patients. I'm happy to report my hospital has hired 2 more nurses in the last 2 months, but it doesn't begin to close the gap. From what I've seen, the lack of orientation for these nurses will continue to be a danger to patients. How would you like to be lying in intensive care knowing that the nurse at your bedside is actually experienced as a geriatric or an obstetric nurse, or the nurse who's performing your daughter's blood transfusion has never done it before? The motto of Sleepy Eye Medical Center is people you know caring for people you love. Unfortunately, it is getting increasingly more difficult to provide safe care for friends, families, and neighbors when our hospital does not abide by safe standards of care in staffing. Please help assure the patients at my hospital and across the state that there will be adequate staffing in their hospitals by voting yes on the Standards of Care Act. If you ask me what brought me here today, it was my patients.